I'm the Executive Director of the New Mexico Conference of Catholic Bishops. I welcome you here today to talk about these very, very important issues, and particularly to announce that we're bringing a coalition of members together for New Mexico for ethical medical treatment. We have a number of organizations coming together to be able to defend the dignity of the human being, to address the issues of the earliest, most innocent issues of life to all the way to natural death. As some say, from the womb to the tomb, a consistent ethic of life. And so we're very happy that this morning we have faith leaders with us, and we have doctors, and we have support from across the state and across the nation. And so I would like to introduce to you Archbishop John Wester, Archbishop of the Archdiocese of Santa Fe.
Thank you very much, Alan, and it's an honor to be here, and Representative, it's an honor to be with you, and also to the doctors who are here today. I'd like to say to them how grateful we are to you for your lives of dedication and service to all people, all humanity, and how you've dedicated your skills and your experience and the talents that God has given you for the health and well-being of so many. So it's an opportunity for us to thank you for all that you do for life and for people. And I also want to say, as Alan indicated so beautifully, that the Catholic Church stands, our Catholic Conference stands, Bishop Cantu, Bishop Wall, and I, Archbishop Sheehan, Archbishop Emeritus, Bishop Ramirez, and the people of our dioceses stand very strongly for life. And in particular, in this case, we want to emphasize what Alan just said, this consistent ethic of life, that the Church is very consistent in her teachings, that from conception to natural death, we believe in the sanctity of human life. And so therefore, obviously, we talk about the death penalty. We're against the death penalty because of the sacredness of life. We're against abortion because it destroys innocent human life. And so we are opposed to assisted suicide because it's taking life. There are many, many arguments, and those have been made and will continue to be made on the point of view of morality, of ethics, of legality, of competencies, and the human condition. All these kinds of factors come into play. And so, for example, we know, and again, we thank our doctors and our physicians, but they'll be the first to tell you that they're human beings. They're not God. God is the giver of life, all life. And doctors, while they do their best, things can happen, mistakes can be made. That's not uncommon. And that's why doctors make sure that they get second opinions, why you have an attending physician, you have a diagnosing physician, you have people who are all involved in different stages of our health care. But we have to humbly admit that we're human beings and mistakes are made. And how sad that a mistake would be made. Someone would be given the news that their condition is terminal, when in fact it's not. When in fact God has other ideas. I remember when I was a young seminarian, Father Beansy Campbell, God bless him, this is decades ago, but he used to chuckle. He said, he'd say, you know, the doctor gave me 5 years. I've been alive for 15. The doctor died last year. No offense against doctors, but I'm just saying that you don't know, and doctors will be the first to tell you that. We can do our best, but God is the giver of life, and things happen sometimes miraculously, sometimes inexplicably, that we don't know. So that's one of the issues. Another issue, of course, is the issue of the conflict of interest, that we know from experience that when we have an occasion of a state that's legalized assisted suicide, that it involves people then in conflicts of interest. The people making very important life and death decisions have other interests at heart as well. And sometimes, sad to say, the life of that person may not be the top of the priority. And yet we know that life is at the top of our priorities. It is sacred that we're made in the image and likeness of God. And so this is another issue that must be looked at, that we're putting people in very, very difficult moral predicaments because they may have other interests and they may not have the interest of that patient at the highest of their lists. Another reality might be too for the person himself or herself who has a terminal condition and wanting to provide, say, for their children, may be in a position where they'll say, well, maybe I should just go. Maybe it would be better if I just die and then they can have my inheritance. And all my life I've wanted to provide for them, and I don't certainly want now to cost them all this money. Well, nobody should be put in that position. And that's another reason why we would oppose assisted suicide. There are other issues as well, one of which I'll mention because it's rather obvious. I'm a faith leader. We believe strongly, as I've said so many times in this press conference, that God is the giver of all human life. And that God in His love and in His wisdom for us has provided for us. Death is not easy, but it's very much a part of life. We sometimes compartmentalize and say, well, life is here and death is here. And if you think about it, our society says, well, avoid death at all costs. We have to be perfect, we have to look perfect, we have to be young and have white teeth and perfect hair and all this. But that's not reality. The reality is that death is a part of life. Frankly, the birth process is just the other flip side of that. I'm sure if when we were in the womb, if we had the choice, we'd say, no, I don't want to be born. This is kind of comfortable here. Things are rather nice. But we're born. It's not easy. It's painful for both mother and child, but we get through it and go, this is wonderful. Well, it's a similar thing at the end of life. Death is a part of life. It's a part of the process. And we know that the night gives way to the day. And we know that the darkness gives way to light. And that's our faith. And even if you're not a person of faith, it's something that's in us. We know about this mystery. And to have assisted suicide is to cut that short. We live in God's time, Kairos time, not our time. And I've seen so many beautiful reconciliations in the last days, the last moments of a person's life, where they reconciled with God, where they reconciled with family members, and yes, even when they reconciled with themselves, and they've come to be at peace within themselves. And by offering the option of suicide, it cuts that short. It's us saying to God, no, God, not even you can help anymore. That's playing God, and that's not right. So for all these reasons, we hope that we can go forward and defeat any effort that would impose this very terrible legislation on our people in our state, that of assisted suicide. Thank you very much.
I'd like to introduce Dr. Greg Smedley, Director of New Mexico American Academy of Medical Ethics. Thank you, Doctor.
Thank you, Alan. My name is Greg Schmades. I'm a licensed physician here in New Mexico. I'm board certified in ear, nose, and throat and head and neck surgery. And as Alan said, I'm speaking on behalf of the American Academy of Medical Ethics, which is a nationwide organization that represents 18,000 physicians. Now, physician-assisted suicide is known in this legislative session as aid in dying, and it's highly dangerous for New Mexicans. This law, if it goes into effect, will give doctors the power to prescribe a lethal prescription that's intended to end the life of the patient, given that the physician believes that the patient has a terminal diagnosis. Okay, this is the issue we're talking about. Let me read a definition, because proponents of this law are calling it aid in dying. Opponents are calling it physician-assisted suicide. So let me try to reconcile that very quickly. The American Medical Association, of which there's about 250,000 physician members in this country, the American Medical Association defines physician-assisted suicide as follows. Physician-assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means and or information to enable the patient to perform the life-ending act. So I'm going to refer to this issue as physician-assisted suicide based on this definition, because this is exactly what we're talking about in New Mexico right now. Okay? Now please allow me to read the official position of the American Medical Association, which is also adopted by the New Medical Society and the Greater Albuquerque Medical Association. Quote, physician-assisted suicide is fundamentally incompatible with the physician's role as healer, would be difficult or impossible to control, and would pose serious societal risks, end quote. So this is what the doctors are saying, okay? AMA, NMMS, and GAMMA, okay? Changing the laws that govern how physicians practice changes the entire framework of medicine and healthcare. This law will change healthcare by diminishing patients' trust in their physicians. Now, the proponents of this law will tell New Mexicans that this law is about providing compassion and choice for the terminally ill. Despite what the framers of the law will tell you, I would argue that all human beings have intrinsic dignity, not based on what they can and cannot do, not based on their sickness, their pain, or their disability. True compassion, rather, is standing beside our sick and our suffering, providing for their needs every step of the way, but not hastening them to an early death. 89% of patients who exercise this option in states where this is legalized, they don't do so because of pain. They do so because they feel they've lost their autonomy and their dignity. I say New Mexico, instead of giving early death, should advocate for people who feel like they've lost their dignity and be willing to tell them that they still have value based on the simple fact that they're being who they are. I'm talking about intrinsic value. Okay? Now onto the issue of choice. The proponents will tell you this is increasing choice. And it is for a very few amount of people that I'll tell you about. The practice of physician-assisted suicide is legal in 5 states. Now, for example, in Oregon and California, insurers, both public and private, have already begun to scale back on their life-extending treatments, such as chemotherapies, while readily providing assisted suicide medication free of charge. When New Mexico considers this issue, let's remember that we have a 20% poverty rate in a very unique demographic that is different from Oregon and Washington. The poor often don't have access to expensive medical treatments, so will they really have a choice? This law is practiced. If it's legalized, it will be practiced within a finance-driven healthcare system. And in a state with a high poverty rate, we are particularly vulnerable to cost-cutting measures in healthcare. Let us not cut costs by providing early deaths to those who cannot afford to live longer. This is simply a law that will increase patient choice for the rich and the well-educated, while eliminating choice for the poor and uneducated. We already have a large rich-poor gap in this country, and we should not widen the autonomy gap. A healthy New Mexico will carry their burdens, will help others carry their burdens while recognizing everyone's intrinsic worth and dignity. So in closing, the real challenge for our society is not the issue of assisted suicide, it's not the issue of aid in dying, rather it's to make quality end-of-life care available to all Americans and to truly value those who are sick and suffering based on their intrinsic value as a person. Thank you.
New Mexico for Ethical Medical Treatment also wants to address another very important issue that will be heard in the 2017 legislature. And this is about aid to an infant born that survives an abortion. And so I want to introduce to you Dr. Mary Rose Turner. Thank you, Doctor.
Thank you all for being here today. My name is Dr. Mary Rose Turner, and I'm a resident of Santa Fe and retired from 30 years of practice in anesthesiology. I'm here to announce my support and involvement with the New Mexicans for ethical medical treatment. We have recently heard of shocking and appalling testimony from UNM Hospital's Chief of OBGYN Department that when infants survive an abortion, that they are not resuscitated and that no training is given on what to do. We need protections for infants born alive to ensure the federal statute, the Born Alive Infant Protection Act, is being enforced. This is happening in New Mexico hospitals and abortion clinics by the sworn testimony of abortionists themselves. In fact, according to the CDC, there are over 500 cases of infants surviving these attempted abortion procedures, and they are continuing to occur on a regular basis. UNM hospital policy states, quote, "In patients who elect labor induction, we discuss the possibility that the abortus may be born with signs of life," unquote. And they also state, quote, "Fetal demise may take up to 24 hours. I'll repeat, fetal demise may take up to 24 hours. This means it can take 24 hours for that baby to die. The doctor who wrote this policy has testified that neither she nor students she is training knows what to do when an infant survives an abortion. This is clearly unacceptable when a trained OBGYN doctor states she doesn't know how to handle a live birth. As a civil society, we must all ask, what happens to the baby? We know that a crying baby in an abortion clinic makes for bad business, and we know that it can happen. We know what can happen. Late-term abortionist Kermit Gosnell would ensure ensure the demise of live-born infants by severing their spinal cords with scissors, or late-term abortionist Douglas Carpin in Texas would twist off the heads of infants who survived an abortion attempt. Without accountability measures in place, can anyone say that this couldn't happen here in New Mexico? Home to one of the largest late-term abortion clinics in the nation, where our own university hospital is also performing abortions well into the 3rd trimester. And this is why New Mexicans for Ethical Medical Treatment stand in support of legislation to address these tragedies. We support HB 37, the Infant Born Alive Protection Act. This measure would ensure that infants who survive late-term abortion attempts will be treated humanely. At the very minimum, a warm blanket and necessary medical attention, not left to die for up to 24 hours alone in a hospital or an abortion clinic, or worse. It is absolutely unconscionable that we have to even address this issue. However, in the words of the great Dr. Martin Luther King, quote, "The law cannot change the heart, but it can restrain the heartless." We have heard from opponents of this type of legislation that this puts an undue burden on doctors, that somehow helping an innocent baby is politically motivated. I am here to remind the Republic that first and foremost, our duty as physicians is to preserve life and do no harm. The Federal Born Alive Infants Protection Act grants all the rights of U.S. citizens to those infants who survive abortions. And HB 37 will put in place accountability measures necessary to ensure that these infants are protected and cared for. Compliance with the law is a requirement for all physicians and must be a component of standards of care for abortionists in New Mexico. We must not let the ideology of pro-abortion extremists in our state prevent us from offering compassionate medical care and treatment to all citizens, especially the most vulnerable. Thank you.
Thank you, Doctor. I'd like to introduce the legislator who has introduced the Infant Born Alive Protection Act, Representative Rod Montoya.
Thank you for everyone who's here, and in particular the church. This is an issue that became clear as myself and other Republican legislators here in the Capitol started looking into this issue about 2 years ago. And what we started finding out, first off, was the secrecy that surrounds the entire abortion industry. The best way for the abortion industry to succeed, and the easiest way, is if the facts of what happened are never presented. And when I introduced this legislation last year, and I thank you, Dr. Turner, for virtually saying anything that I could have really repeated just a few seconds ago. But Dr. Turner was my expert witness on this issue. And what we presented at that time was, this is happening. This is happening. We, the folks who are against this want to say this interferes with choice. And the Federal Born Alive Infant Protection Act says that you do not have choice beyond the child exiting the womb. And regardless of the infant's circumstance of birth, whether it's premature, cesarean, natural birth in a hospital, or after an attempted abortion, that if that child is born alive, that child is an American citizen, and as such has every right of every other citizen of the United States of America, including, at the very least, humane care. In discussions with folks recently about this, the idea of whether or not we could treat an animal this way. What would happen if we left a child or an animal to die? We put people in jail for that. The particular, what they call fetocide, that they introduce to the child's heart, you can't do that to an animal. To a conscious animal, that's an act of cruelty. The opponents last year tried to say that, first off, this doesn't happen. And the only way that that can be stated, that this cannot happen, is it's not recorded. And I've met a few times with folks, administrators at UNM, who, quite frankly, are teaching huge numbers of these late-term abortionists happen right here in New Mexico. And the administrator, as mentioned earlier, in sworn testimony, a sworn deposition to the Federal Born Alive, or the Federal Panel on Infant Lives, this last year, stated, beyond what Dr. Turner mentioned earlier, that she doesn't even know how this applies to her practice. And this administrator is the person who is responsible for the content of training new abortionists, OBGYN doctors, and abortion folks who are going into the industry. And make no mistake, this is an industry. And that's why it's being protected. And quite frankly, I believe that the reason that members faculty at UNM have been resistant to even being interested in complying with this federal act has been the massive amounts of money, grant funding and otherwise. So, what has happened, just so folks will know, as myself and other legislators have looked into this, is the slow walking of the process. Giving a little bit of information. Having a meeting and canceling a meeting. And this happened where members of UNM who were supposed to testify before a federal committee that asked them to testify, and they would make a meeting, or they would set a date for a meeting, and then they would cancel at the last minute. The moment that the public becomes aware of, first off, even in the abortion industry, just prior to birth, prior to what my legislation will be hopefully fixing here in New Mexico, the idea has been passed on to the public that this is a mass of sales. But what through that investigation of that federal panel, what happened was the humanity of the children who are the victims of this became clear when the public started hearing about limbs and hearts and brains and eyes that were being presented as valuable commodities for research. I would encourage UNM, find another area to be experts in research on. I think that going forward I'm going to have the same resistance. But last year I was not prepared with what I could not get certain testimony from this particular administrator when we asked to have this person present to talk to legislators here in New Mexico. Since I don't have the power of subpoena, wasn't unable to compel them enough to provide this person. But I want to read the specific deposed testimony. When we were told in committee last year that this doesn't happen, and that a child is not born with signs of life. By the way, everybody in here was born, and most of you have had children. And I tell you what, I've had 4 children, and when those children come, when the child's ready to come out, period. And the way that this particular induction abortion procedure works is, it's the heartbeat stopper, the infanticide that's injected into the uterus or into the, I'm sorry, I'm not being technical enough here, but it basically stops the heart. And it's supposed to allow that, and that's where it's supposed to take 24 hours for that to happen. But if that child, at the same time, they induce an abortion, or induce labor. And so what's supposed to happen, according to the documents that Dr. Turner referenced that was signed by the same administrator who was unwilling to answer the questions for us, is that it's supposed to produce a dead fetus at the point that the child comes out. Well, we know that doesn't happen all the time, to the point where there are 500 nationally that are being self-reported. That tells you how many are not being reported. We know it's not being reported all here in New Mexico. So the testimony of even whether or not this is being taught to students at UNM, this is how the questioning goes. Question: so does your curriculum call for training of doctors on what to do if a child was born alive? Answer: no. Question: no training at all. Answer: no. Question: so there's no resuscitation training? Answer: OBGYN doctors do not resuscitate neonates. Do not. Now, this testimony is particularly troubling since the administrator who gave this testimony, her name appears on all of the documents that say that a child can be born alive, or can be born showing signs of life, and that it can take up to 24 hours for fetal demise. This is the same administrator whose signature is on those documents. So I'm very thankful that the church has decided this is one of their priorities for this session. And I would ask that folks contact UNM. Begin there. The abortion doctor who's in business just to provide abortions, they're not going to listen no matter what. But UNM takes public funds to operate, takes your tax dollars, should be complying with federal statute, and hopefully when my legislation gets passed, it will be state statute as well. Thank you very much.
Thank you, Representative Montoya, for your passion and for your commitment to defending life. We appreciate everything that you do and your leadership in this area, and we just hope that more legislators and more leaders like him would come forward. So thank you so much again, Representative. We just want to close by saying, New Mexicans for Medical Ethical Treatment is a partnership of a number of groups and organizations across the board. Today with us we have Donnie Dulce with New Mexico Right to Life. And she is also a member of this partnership. But we also have groups across a spectrum of adoption, religious, healthcare, and human rights organizations. We are also partnering with the Adoption Assistance of New Mexico, and they will be available in the cases of when an infant is born alive in a hospital from a failed abortion, and the mother or the parents do not want that child, that there's other options. And the Adoption Assistance Referral Network is willing to take on that child and ensure that they are turned over to loving family who will care for them. So there's solutions to these issues across the board, and we just want to, again, thank all of our partners today, and we will continue to fight here at the legislature, not only for the Born Alive Infant Protection Act, but for against measures for physician-assisted suicide. Thank you so much for your time.